The exam question was not only asking for non-pharmacological advice for ethics experts, but asking why we give that advice. And that shows greater understanding about what you've learnt in the lecture. The fungus likes a warm, moist, airless environment, and therefore we advise people to avoid tight shoes of synthetic material because it's impossible for the moisture to evaporate. Wearing leather footwear allows the skin to breathe more. We advise to wear cotton socks because, again, they facilitate moisture evaporation, and nylon socks will prevent this. We advise to wash and dry feet thoroughly. Again, this is because the fungus thrives in moisture, so if we're drying the feet thoroughly, we're removing some of that moisture. And avoid walking in bare feet, and this is because the athlete's foot is contagious, and therefore you risk passing it on to other people. So in places like sports changing rooms and swimming pools, again, because there's a lot of moisture there, wearing flip-flops will help prevent that the athlete's foot being passed on to others. We're going to move on to warts and verrucas, and these are rough growths that can appear anywhere but are more common on the hands and feet. And it's caused by a virus, the human papilloma virus. They're more common in children, and that's thought to be due to a higher exposure of the virus in a schools and sort of sports facilities environment. Again, these are quite contagious. They can be caught by close skin-to-skin contact, but also indirectly from contaminated objects. So things like towels or shoes. Verrucas are quite commonly spread in swimming pools. Also things like scratching, knocking or biting nails, sucking fingers. These are some common signs and symptoms. Parts of the skin subject to regular trauma or friction are more likely to be affected, and there tends to be raised skin growth with a hard, uneven surface. With verrucas, some of them can be painful, and this is because when weight is applied, the lesions get pushed inwards. There can be a network of capillaries, and this will help distinguish between calluses and verruca, and they look like sort of little black dots in the centre of the lesion. The top two pictures show warts and the bottom two verrucas, and you can see with the verrucas there's the black dots, which are the signs of the little blood capillaries. Reasons for referral. So if there's any treatment failure, as with any condition, if there's any lesions on the face or genitals, or there's multiple clusters. And as we've mentioned before, those patients who have a compromised immune system, whether that's through a condition or medication, diabetic patients, or those who are pregnant or breastfeeding. In addition, anybody who has neuropathy or peripheral vascular disease, that should also be referred. If there's any bleeding or itching with the lesions, and in particular, I'm worried about a more malignant condition, if there's any change in appearance, whether that's size or colour. There are over-the-counter treatments available, although you don't have to treat. They will clear up themselves eventually, although it can take a very long time, 2 years sometimes for warts, and they do tend to last longer in older children and adults. No treatment is 100% effective. The aim is for removal of the wart or verruca and to prevent them returning and prevent any scarring. You do need continuous application for several weeks or months, and this should be explained to the patients that it's not going to be a quick fix. There's not going to be an immediate cure overnight. And no products available over the counter should be used on the face. So treatment options available, there's either salicylic acid or cryotherapy. There are many products available for salicylic acid, and it's the first line treatment. They soften and destroy the lesion by chemically burning and removing the affected tissue, but they can cause damage to normal skin, and therefore you need to protect the surrounding area, whether that's with a petroleum jelly, something like Vaseline, or a corn plaster. Guidance on application. So before the first application, soak the wart or verruca in water for about 5 minutes. This helps to soften the skin and hydrate the skin, which means that it's better action for the product when applied. Use an emery board or pumice stone to file down the area beforehand, and this will remove any dead skin from the surface. After the first application, then you only need to soak in water for 2 to 3 minutes before application. Only apply to the affected area. As I said, it can cause burning of the skin, so try to avoid putting it on the healthy skin. Allow it to dry. There's then no need to put any sort of plaster or dressing over the top. Then the next day, when you're ready to reapply more, you can peel off the white patch area before application. Then about once a week, file down with an emery board to remove any of that dead skin. Cryotherapy is a lot more harsher treatment. It's liquid nitrogen, and you just apply it for a few seconds, and it works by freezing and destroying those affected skin cells. It can be quite painful. It can cause blistering and skin pigmentation, and also it can change the nail shape and structure if it's used near a nail. It shouldn't be used in pregnancy or breastfeeding, and after about 10 days then the wart should just fall off. Remember that treatment for warts and verruca is a slow process. It can take up to 12 weeks, and people need to persevere with it and adhere to the treatment for it to work. Those practical tips we can give to prevent getting a wart or verruca: do not touch other people's warts. Try to prevent sharing things like towels or flannels, shoes, socks, and no scratching or picking. If you've already got a wart or verruca, then it's about reducing that transmission to other people. So if you've got warts on your hands, maybe wearing gloves in the gym, or as we said earlier, in swimming pools or changing rooms, you can wear flip-flops. If you are going swimming, there's some swimming socks you can wear for verrucas to prevent transmission to others. Our final topic, corns and calluses. So these are both are areas of hard, thickened skin, and they develop due to excess pressure or irritation against the skin. They normally occur on the feet, but they can occur on hands too, and they can be quite painful and give some discomfort. Women are more predisposed to them, and that's generally due to their choice of footwear. Some differences between the two: corns can tend to develop as a result of excess pressure. Calluses, the thickening is evenly distributed and is often caused by friction. When do we need to refer? As with all conditions, if you've tried treatment and it's failed, those more at risk, so anyone with vascular conditions, neuropathy, neurological conditions, those who are immunocompromised, whether that's due to a medical condition or medication they're taking, and diabetic patients. If really causing any intense pain or affecting the walking or posture, and if the surrounding area of the callus or corn is really red. Treatment involves removing the cause, so whether it's the pressure or the friction, and removal of the thickened skin. And if necessary, you might need to refer to the GP or a chiropodist. Wearing comfortable flat shoes helps, and if you have calluses on the hands, wearing protective gloves. Products available, you can get rehydration creams. There are creams to try and soften the hard skin. You can have soft padding, maybe having some nice soft foam or silicone insoles in your shoes. And the foot care, really, the aim of it is to allow the hard, thick skin to heal and try and redistribute the pressure, to take that pressure off a single point. There are many products available, and it'll be worth just going into a chemist or or into a supermarket to have a look to see what is available and out on the shelves. As with warts and verrucas, we can use salicylic acid to treat corns and calluses, and it's used to soften the top layer of the dead skin. It's quite mild in strength, so it shouldn't cause too much of a problem, and it's applied directly to the area. There's lots of different formulations again, liquid gels, medicated plasters, so it's finding out which formulation is best for your patient. Practical advice we can give: drying the feet thoroughly after washing and before applying foot cream to them, using a pumice stone or a foot file regularly to file down that rough hard skin. Wear comfortable footwear, try cushion insoles as well, and make sure that the footwear fits properly, so there's no pressure points on the feet at any one point. So hopefully now you're more familiar with the types of skin disorders that you could come across in your community pharmacy. You can differentiate between the different conditions based on symptoms and the patient's history. Be able to adapt your questioning so you can work out and diagnose the problems and pick up on those warning signs. Be able to advise on appropriate over-the-counter treatment, and also that all-important non-pharmacological interventions. As always, if you have any questions, please do not hesitate to email me. I know with responding to symptoms, particularly if you've got no experience in pharmacy, it can be quite daunting. There are so many products available, but I'd advise, if that's the case, you can go and spend some time in a pharmacy or a supermarket and just look at the products that are available on the shelf, and you can see what sort of ingredients they contain.